Sukarya is a women-focused, women-centric and women-led organization that works towards uplifting and empowering underprivileged women, adolescent girls and children and prepares them for a more efficient and better living. So let's take a look.
With a firm belief that health is one of the most important and fundamental rights of every individual, Sukarya has been serving local communities since 1998. Sukarya was created as a result of Meera Satpathy's vision and worked towards prevention of anemia amongst women, pregnant lactating mothers and children, malnutrition in women, children and adolescent girls, infant mortality, women's health and nutrition. The organization has been a strong advocate of women's empowerment since inception and places them at the center of the development curve, equipping them with education, life skills, training, and entrepreneurial skills. Sukarya works with women at the individual as well as group level to build their self-esteem and self-worth. Sukarya has been enabling tens of thousands of women and adolescent girls in the villages and slums to make their own decisions and actions for their health, nutrition, economic freedom, as well as their children's health, education, and well-being. Sukarya also gives emphasis on mental health counseling for women, especially after COVID impact. Sukarya stands for good work and has differentiated itself on the basis of transformative work undertaken over the last 25 years. It stands alone in its direct and human approach to social service and focuses on giving back to society by empowering the underprivileged living in the slums and villages of Delhi, Haryana and Rajasthan and providing them with quality primary healthcare services with special paramount focus on prevention, control of anemia and tackle malnutrition, education to slum children and empowering young adolescent girls to understand gender equality. Sukarya today is not merely a developmental organization focusing on health, but also an organization that values empowerment through raising awareness and enabling people to demand better services for their well-being. Sukarya vision towards enabling local communities believe in their own abilities to bring about change by providing them access to basic healthcare, nutrition and education to live a healthy, successful life and strive for a better society. Fulfilling its mission of ensuring fair and equitable access to quality health services for all, each of the interventions are designed and implemented to meet the following 6 objectives. First is to improve maternal and child health. Second is to advocate, promote and sensitize communities on primary health care, reproductive child health and family planning. Third is to advocate, encourage and guide positive health-seeking behaviors. Fourth is to promote gender equality, equity and justice. Fifth is to educate and empower children and youth to lead a healthier life. And sixth is to empower women by strengthening their physical, emotional well-being and economic stability.
Striving for a better society is the motto of our organization. And that is the basic fundamental line or theme that I had picked up to establish this organization, to work for women and children. And fundamentally, it was a compelling and conscious decision to uplift the underprivileged women and children. And it is just to feel that women are the pillar, they are the strength of the society. And without them, it is impossible to run a society or a family or a community or a country. They are the co-partners of men. And that's why it is so important that women should be given equal opportunity, equal status, not to be undermined. Our programs are basically structured. One is a specific goal that we will educate the underprivileged children. And the program that we had designed is just to take a school to them so that these children who come from very unstructured background, have never gone to school before, never even know how to study. So these are the children who get the chance to get that school, come to that bus and get some education. The journey has been possible because of determined people all around me, those who support and those who plan to walk with me so far. And we are a committed, dedicated and hardworking organization. We work with transparency and give back to society. We provide qualitative services at low cost. And that's why Sukarya is here to lead, and we are already working as change makers of the society.
Sukarya works closely with community people, stakeholders, government system and other significant entities towards their 4 core areas, namely maternal child health nutrition and adolescent health, MCHN+A, under which the organization works towards improving the maternal and child health, MCH status of mothers and infants, reducing infant mortality rate and morbidity amongst children and mothers. Gender equality, under which the organization aims towards educating and empowering adolescent girls aged 10 to 19 years through curriculum-based training on reproductive sexual health issues, their rights, and building their knowledge and awareness on gender justice. Education for slum children, under which the organization organizes education on wheels, EOW, through a well-equipped bus which is mobile and moves with teachers to different locations. It has on board computers, television and other essential education-related materials to educate children living on the streets and in impoverished neighborhoods by providing them functional literacy. Women Economic Empowerment, under which the organization works with women living in peri-urban slums and villages, and by forming SHGs and collectives, they are provided knowledge and skills to save money, engage in income-generating activities, and become agents of change.
मेरे में खून की कमी हो गई थी, उसकी वजह से मेरा काम भी छूट गया था, तो मैं सुकारिया से यहाँ दवाई लेने के लिए आई। उन्होंने खून टेस्ट किया, मेरा खून की कमी थी काफ़ी, उन्होंने दवाई दी मेरे को। अब उससे पहले से काफ़ी बेहतर है, मैं काम पे भी आने लगी वापस, और अब मैं यहाँ पे हेल्थ वर्क का काम भी कर रही हूँ, औरों को जागरूक भी कर रही हूँ, बच्चों को बुला के ले जाती हूँ कैंप में।
सुकारिया एनजीओ से मैं पिछले 9 महीने से जुड़ी हुई हूँ और इसमें मेरे को बहुत सी चीज़ें सीखने को मिली है और मैं बहुत कॉन्फिडेंस आया। पहले मैं अपने पेरेंट्स से पीरियड्स इन सब चीज़ों के बारे में हिचकिचाती थी और किसी भी चीज़ या काम करने से मैं डरती थी, पर अब मैं आत्मनिर्भर या कॉन्फिडेंट हो गई हूँ और मैं अपने घर पे लड़कियों को इकट्ठा करके उनके साथ जेंडर के सेशन ले पाती हूँ।
हम जब बच्चे को छोड़ के काम पे जाते थे तो हमारे बच्चा पता नहीं कहाँ घूम रहे, क्या खा रहे, क्या कर रहे, फिर वो टेंशन लगा रहता था। फिर वो हम मैम जाके हमारे घर में जाके हमें समझाया कि कैसे बच्चे को पढ़ाना है। फिर हमने यहाँ पे आके दाखिला करवाया बच्चे को। मेरे 2 बच्चे यहाँ पे पढ़ रहे हैं, उन बच्चे को खाना भी दिया जाता है, फिर हमें उतना टेंशन नहीं रहते।
ऐसे स्कूल मैंने पहली बार ही देखा है। इस बस में स्क्रीन लगा हुआ है, उसमें कविता पढ़ाई जाती है। मुझे सुकारिया बस में पढ़ के बहुत अच्छा लगता है।
Sukarya is fortunate to have a team that is committed, caring and optimistic about bringing change to the geographies they are in. And it is with their endless efforts that throughout the years, Sukarya has directly and indirectly benefited over 6 million people in more than 650 villages and 120 slums in Haryana, Delhi and Rajasthan. For Sukarya, the past 25 years have been an immense journey filled with many milestones that have enriched and impacted millions of lives. And now they are looking forward to ensuring that the positive impacts of their initiatives become instilled in people's behavior so that they become active partners rather than passive spectators.